disc herniations certainly can heal. A lot of chiropractic work is dealing with disc problems, disc pain, and including disc herniations, disc bulges, and so forth. We cannot mostly diagnose that with a physical examination and x-rays, but we certainly can have suspicions of that on these exams and x-rays. MRIs can confirm if there are any serious disc pathologies, disc bulges, herniations, prolapses, sequestered discs, and so forth. Okay? If you are someone that has severe pain, worst pain ever, sharp shearing pain down an arm or leg, or both legs, or bowel bladder changes, and so forth, you need to be calling 911 and getting yourself to an emergency room immediately, because you might have a very severe disc bulge herniation prolapse that's actually directly putting pressure on a nerve or the spinal cord, and that needs attention immediately. So just keep that in mind. I've talked about disc problems many, many times on this show before, but I wanted to give you an example of a disc herniation that healed because we've seen this many times. So this is a lower back disc herniation. 49-year-old man comes in to see me. He has seen me in the past. I saw him 3 years ago for an upper back problem. We worked on him for a month. It resolved. Then a couple of years later, last year, we saw him because he was starting to get some rumblings in his lower back after golf and after bowling. So he had some rumbles in his lower back, and then I said, you know, you probably want to come back and get this checked or tuned up and so forth. He didn't do that. Sure enough, about 3 months later now, he was upping his running, and sharp, really sharp low back pain started. It was going down into his left hip, then his left leg to his knee in this case. I started working on him a couple of times. He comes in on the third visit. He could barely put any pressure on the left leg. Okay, so really, really severe. This is not most people, but this does happen. I recognized immediately that this was beyond my care at the time. So we shipped him immediately to his primary care physician. He ended up in urgent care, so forth. They prescribed him some heavy-duty medication. He had steroids, Vicodin, eventually gabapentin, and so forth. So these medications got him over the hump. He had the MRI. It showed a disc herniation on one level. It was on the left side where he was having that driving, nasty leg pain, very common scenario. The medications started to turn the tide for him, so he was able to start coming back and seeing me, and he also went to physical therapy. Within a month, he was pain-free, a tiny bit of stiffness in his lower back, a little bit of weakness remaining in his hip muscles, but he was able to get back to work. During that month, I think he was going to physical therapy a couple of times a week for about 3 weeks, and then that stopped. He saw me at least 3 days a week. He's still seeing me now 2 days a week as we're just getting that last 5 or 10% improvement as he's gradually improving his activities and so forth. But clearly he's way out of the woods now, and the beauty of this is he's going to take really good care of his spine for the rest of his life. So he understands the importance of, even though I'm out of pain, I'm fine, I don't need to take care of my spine or pay attention or go for maintenance chiropractic care or do my spine stretches or lift properly and so on and so forth. He's now going to be quite an advocate for those things moving forward. So that's a case of an acute disc herniation that's clearly healing. What would be interesting for him to have an MRI right now or a couple of months from now to see the condition of the disc. It would be interesting academic exercise, although it would never be approved by insurance, to do that. It would be something self-pay or research on the name of research or something like that. But I have had some cases, which I've talked about in the past, where we have had a pre-post MRI. Herniations were there, no surgery, no injection, conservative care, chiropractic and/or physical therapy and/or exercise and so forth, and all of the same pains and symptoms are gone, and then a follow-up MRI shows that the herniation is also gone. So just keep in mind, a lot of these neck, and the same thing can happen in the neck, you can have a herniated disc in the neck, closing down the nerve hole with pain going down the arm and so forth. And a lot of these things can get better with conservative care. That's what happened here in this case. He is extremely thrilled to be back living life again. And of course, I'm happy as a practitioner that he was able to get better without any more significant medical procedures. I'm Dr. Scott Fuller. Thank you.